Hello everyone, I'm Mrs. Jyotsna Puthran, clinical dietitian, student of South Wales University. Today I would like to talk on diabetes and macrovascular complications. Now let me explain you what is diabetes and how does it lead to complication. Diabetes is a condition in which the body is not able to produce adequate insulin. Insulin is a hormone which is required to metabolize your blood glucose. And when your glucose is not metabolized, there is increase in blood sugar level. And this high blood sugar level can reduce the energy, growth, and immune response. Eventually, it can also lead to damage and failure of organs like heart, kidney, brain, nerves, and eyes. On a long run, high blood sugar can lead to deposition of fatty material in the inner lining of blood vessel walls, as shown in this slide. And this can affect the blood flow, resulting in clogging and hardening of arteries, termed as atherosclerosis. Diabetes complication. It consists of microvascular complication and macrovascular complication. Now, microvascular complication, small blood vessels are affected, like retinopathy, neuropathy, and nephropathy. Whereas in macrovascular complication, large blood vessels are affected, and the most common is heart attack and brain stroke. Factors that contribute to macrovascular complications are insulin resistance, high blood pressure, high blood cholesterol, smoking, abnormality in blood clotting. These risk factors have both genetic and environmental background, which contribute to the accelerated manifestation of cardiovascular disease. Now, diabetic people are 2 to 4 times more prone to macrovascular complication than compared to the people who are non-diabetic conditions. This is because of their metabolic imbalances. World Health Organization has estimated that 17.5 million people has died from cardiovascular disease in 2012, out of which 7.4 million people were due to coronary heart disease and 6.7 million people were due to stroke. Cardiovascular disease is the number one cause of death globally. More people have died from cardiovascular disease annually than any other cause. And they're estimating that in 2015 there will be 20 million cardiovascular disease deaths. Here I would like to give an example of my very good friend Mrs. Jean, who is an avid badminton and tennis player. She always thought of herself as an active and in shape. It was during the practice session where she started acting sluggish and suddenly she collapsed. And then she was airlifted to hospital where cardiologists have learned that she had suffered from ventricular fibrillation, which is severe abnormal contraction of heart muscle. And if this condition lasts longer than a few seconds, it could have resulted to cardiac death. Hence, I would like to convey a message to everyone that early diagnosis with systematic screening allows prompt intervention that will delay the further complications. Prevention, timely diagnosis, and treatment needs to be initiated. Lifestyle modification with the behavioral modification is one of the most important aspects that needs to be taken into consideration. As a diabetic individual, you can delay the complications, that is by controlling your blood pressure, your blood cholesterol, and your blood glucose that can cut down the risk of heart attack and stroke. You need to consult your dietitian for healthy dietary choice, stop smoking, take medications if it is required after consulting a physician, continue your follow-up visits with the physician, self-examining your feet every day, reducing your stress because that can decrease the risk of further diabetic complications and increase your emotional stability and well-being. Moderate exercise of 30 minutes is recommended because that increases the sensitivity because that will actually make your body more sensitive to insulin to use up of more of glucose and achieve normal blood targets and other targets. And if you have any warning signs of an heart attack or stroke, you need to seek medical attention immediately because earlier the diagnosis will allow the prompt treatment and this will delay further complications. Hence, I would like to conclude by telling that set your goals when considering your health and well being, and take care of your body because this is the only place to live in, and treat it with love and respect. And very important to be noted is prompt care can make your health easier. So you need to act smart to live smart. Thank you.